If you've spent any time at all looking into wellness or complementary cancer care online, I'm willing to bet you've heard the buzz. It's all about this bright yellow compound from turmeric called curcumin. I mean, it is everywhere, and the claims can feel, well, a little overwhelming. So today, we're going to cut right through all that noise.
So that brings us to the big question, right? What is really going on here? Is curcumin the next miracle cure that's just being overlooked, or is it just another classic case of social media hype? It's a really tough question, and in this explainer, we are going to dig into the early-stage scientific evidence to find some real answers.
You know, this quote from the source material really nails the situation we're in. On one hand, it's telling us, hey, let's calm down, this stuff is definitely overhyped. But on the other hand, it points to something much more substantial hiding underneath all that noise. Some early clinical data that has researchers genuinely intrigued and actually calling for more studies. So first up, let's separate that social media buzz from the actual scientific hope. And to do that, we've got to start with the fundamental idea that has researchers so excited in the first place, the real why behind all these clinical trials.
And that idea, well, it's all about the powerful and really well-established connection between chronic inflammation and cancer. Before we can make any sense of the results we're about to look at, we absolutely have to understand this core principle.
Okay, so the basic science here is actually pretty straightforward, but it's incredibly important. When your body has high levels of chronic, systemic inflammation, that's inflammation all over, it creates an environment that can actually help cancer cells to grow, to multiply, and even become more aggressive.
So how do researchers even measure this inflammation? Well, one of the main tools they use is a blood test for something called C-reactive protein, or just CRP. You can think of it like a biological speedometer for inflammation. The higher your CRP number, the more inflammation is revving through your body. And we know that's an indicator of a poor prognosis in a lot of cancers.
And this is where it gets really interesting. In one clinical trial with breast cancer patients, the group that took curcumin saw their CRP levels, that key inflammation marker, drop by an average of 40%. This gives us a direct, measurable link. It really looks like curcumin can significantly lower systemic inflammation.
Okay, so if curcumin can lower inflammation, the next logical question is, does that actually translate into better outcomes for patients? To answer that, let's turn to the clinical trials, and we'll start with some of the most striking early evidence we have, which comes from digestive cancers.
All right, let's zoom in on a very specific study that has generated a ton of interest. This was a phase 2 trial in the UK. It was looking at patients with metastatic colorectal cancer who were all already getting standard chemotherapy. The only difference here was that one group also got curcumin. And the results were frankly incredible. The median overall survival for patients on chemotherapy alone was 200 days. But for the group that added just 2 grams of curcumin a day, the median overall survival jumped to 502 days. Let that sink in. That is more than double. Just an amazing difference to see in a small early phase trial.
And to put this in statistical terms, the study reported something called a hazard ratio of 0.34. Now, in simple terms, what that means is that during the study, the patients in the curcumin group had roughly a 2/3 reduction in their risk of death compared to the group that only got chemotherapy. That's a huge deal.
And you know, these really promising signs weren't just a one-off thing in colorectal cancer. Let's look at another fascinating phase 2 study. This time, it's focusing on patients with advanced liver cancer after they had already finished their chemotherapy treatments.
So in this trial, the researchers were zeroing in on a tiny molecule called MIR21. The easiest way to think of MIR21 is as a rogue messenger inside your body. When you have high levels of it, it can run around and basically switch off the very genes that are supposed to be suppressing tumors. So yeah, it's a key player in helping cancer grow and resist treatment.
So the patients in this study took a combination of curcumin, piperine, that's the stuff in black pepper that helps with absorption, and an amino acid called taurine. And the results were pretty compelling. They saw massive reductions in that rogue messenger, MIR21. And what's really critical is that having lower levels of MIR21 was directly linked to a doubling of overall survival in this group.
So we've seen these really promising results in some early trials. Now let's get practical for a second. How is curcumin actually having these effects, and what are the big challenges of actually using it?
Right. This is the key question, isn't it? If the results are this encouraging, why isn't this stuff being used everywhere? Well, the answer comes down to a really fundamental biological problem.
absorption.
So here's the deal, and this is absolutely crucial. Your body's actually terrible at absorbing standard curcumin from turmeric. We're talking only about 1 to 5% bioavailability. That means almost all of it just passes right through you. This is exactly why these clinical trials don't use standard kitchen spice. They use specialized, high-absorption formulas like the ones you see here that are literally engineered to get into your bloodstream and your tissues where they can do their work.
All right, let's pull all of this together. We've seen some very promising but also very early evidence. So what are the most important things you should really take away from all this?
Okay, here's the bottom line. The early trial data, especially in advanced colorectal and liver cancer, is genuinely exciting. But, and this is a huge but, these are small, early-phase studies. They absolutely have to be confirmed in much larger phase 3 trials before we can draw any firm conclusions. It's also really clear that those high absorption formulas are the key to seeing any effect. And this is important. High doses over long periods could potentially cause liver damage. This is not medical advice.
And that brings us to the single most important message of this entire explainer. No one should ever add any supplement, and that includes curcumin, to their cancer treatment plan without having a really detailed conversation with their oncologist first. Your doctor understands your specific case, your treatments, and any potential interactions. This is a conversation you absolutely must have.
So we kind of end where we began, but hopefully with a lot more clarity now. Could a compound from a common spice really be a key to improving cancer outcomes? Look, the hype is definitely way ahead of the science, but the early hope, the hope that's grounded in these real clinical trials, that is very real. The research is just getting started, and this is a space we are going to be watching very, very closely.